Hello all, I am Dr. Chaitra, practicing homeopathy at Care Homeo Clinic, HSR Layout, Bangalore. Pityriasis Rosea is a common self-limiting skin condition often seen in children and young adults that presents as a reddish pink scaly rash that typically begins with a single large patch called Herald patch, followed by small oval-shaped patches appearing on the arms and legs. It is believed to be triggered by viral infection, possibly a type of herpes virus. It is usually not serious, but it can be quite itchy and, let's be honest, a bit alarming when it first appears. Can homeopathy treat Pityriasis rosea effectively? Homeopathy treatment is considered effective by some practitioners, especially in resistant of severe cases. Remedies are chosen based on individual symptoms and holistic assessment. Common remedies, frequently used remedies including sulphur, graphites, arsenicum, sepia, lycopodium. Among others, they are selected based on the nature of the rash, associated symptoms and patient constitution. Which homeopathy remedies are commonly suggested to relieve itching and rash spread in Pityriasis rosea? It is difficult to recommend specific remedies for individual cases. That's a job of qualified homeopath practitioner to select the individualized medicine. Can suggest about some remedies that are traditionally associated with skin conditions and itching in homeopathy. This might include Rhus and often suggested for itchy vesicular eruptions that are worse in cold, damp weather and relieved by warmth and motion. Sulphur, indicated for intense itching and burning, especially if the rash looks unhealthy or there is history of any other skin issues. Graphite is sometimes considered for dry, rough skin with itchy and fissures. Sepia might be considered if the rash is accompanied by hormonal imbalance or feeling of indifference is important. Homeopathy practitioner will take a detailed case history including your unique symptom, lifestyle and emotional state to determine the most appropriate remedy for you. How long does this rash typically lasts without steroids? It's a good news. Pityriasis rosea is a self-limiting condition, meaning it usually resolves on its own without any specific treatment including steroids. Typically, the rash lasts for approximately 6 to 8 weeks, though it can sometimes persist up to 12 weeks or even longer in some rare cases. The Herald patch appears first, followed by the main eruptions, and then it gradually fades. Steroids are generally not necessary for Pityriasis rosea, as usually only considered for very severe itching, and even then often topical rather than symptomatic. Are these remedies for post-rash pigmentation? Yes, Pityriasis rosea can sometimes leave behind temporary dark or light spots after the rash clears, especially in individuals with darker skin tones. This is known as post-inflammatory hypopigmentation on dark spots or hypopigmentation on light spots. These spots usually fade on their own over several months, sometimes up to a year. Sun protection is crucial during this period to prevent further darkening. From homeopathy perspective, practitioner might consider remedies aimed at supporting skin healing and balancing pigmentation. Again, there would be highly individualized based on specific type of discolorization, your constitution and other symptoms. Examples might include thuja for certain types of skin discolorizations or growths. Sepia, as mentioned before, if there are hormonal factors involved. Arsenicum for unhealthy looking skin with discolorization. Again, this is a complex area and a homeopathy would need access or assess your specific situation. Can homeopathy stop reoccurrence this kind of Pityriasis rosea? It's quite interesting question, because Pityriasis rosea itself is generally not known for frequent reoccurrence. It's quite rare for someone to get in multiple times. If someone experiences recurrent rashes then look like Pityriasis rosea, it's important to re-evaluate to ensure it's not other skin condition. So Pityriasis rosea, because reoccurrence is rare, it's difficult to definitively say that homeopathy stops something that does not commonly reoccur. Homeopathic philosophy aims to strengthen the individual overall health and vitality, which theoretically could make them less susceptible to various ailments. Does stress causes Pityriasis rosea? How can homeopathy help? This is a great point. While the exact cause of Pityriasis rosea is not fully understood, it's widely believed to be triggered by viral infection, possibly a strain of human Herpes virus. Though not same as common cold sore or genital herpes, however, let's well established in medicine that stress can significantly impact our immune system. So, while stress might not directly cause the virus that leads to Pityriasis rosea, a period of high stress could potentially weaken your immune response, making you more susceptible to various health conditions or triggers. It could be exacerbated the symptoms once the rash appears. This is where homeopathy holistic approach might come into play. Homeopathy treatment considers the individualized emotional state alongside their physical symptoms. If stress is the significant factor in your life, homeopathy would select remedies that aim to address your stress, anxiety or emotional imbalances. By potential bringing the body and mind into better balance, proponents believe it could support the body's ability to cope with stressor and recover more effectively from the conditions like Pityriasis rosea.